to the best of our ability. Today's topic will be navigating neuropathy through nutrition. Little is known about what we can do to ease the pains of neuropathy, especially chemo-induced neuropathy. While the studies are fewer than we would like them to be and the information is less than we want it to be, I did want you to have access to information that we do have, thanks to experts who have worked on hypotheses, such as can diet affect neuropathy side effects? Here to tell us more about what type of diet will be most likely to improve or help your neuropathy side effects is Lindsay Colbert. It is now my pleasure to introduce her to you. She serves as the Executive Director for the Foundation of Peripheral Neuropathy, which focuses on raising awareness and support for individuals living with peripheral neuropathy. She is excited to turn the board's enthusiasm into successful outcomes for the foundation and its members. Prior to her joining the foundation in April of 2017, she gained a decade of experience in fund development, strategic planning, and marketing at Chicago-based nonprofits, including Northwestern University and Rotary International. She holds an MA from the University of Wisconsin-Madison. In her free time, Lindsay enjoys traveling, cycling, and watching baseball. Lindsay, we're so excited to hear from you today, and we thank you for coming. And we're looking forward to your presentation. Thank you.
Great. Thank you so much for the generous and kind introduction, Audrey. I really appreciate it. And thank you so much for inviting me here. I'm very much excited to get some more information out to your folks about chemo-induced neuropathy and some nutritional benefits that we can share to help kind of ease it. So I'm going to go ahead and share my screen as well. And just trying to get the PowerPoint presentation up. So today's talk is navigating neuropathy with nutrition. So again, thank you so much for having me. My name is Lindsay Colbert. I am the Executive Director at the Foundation for Peripheral Neuropathy. And before we get officially started, I just want to let you know that I am not a medical professional. So the information that I'm sharing is for educational purposes. And as always, we encourage everyone to check with your doctors before beginning any diet or lifestyle change or supplement regimens, just to make sure that it's something that makes sense for your personal care plan. Before we get started also on nutrition, I think it's really important for me to remind everyone that every patient that suffers from peripheral neuropathy has a unique experience. This is just such an interesting condition in the sense that every one patient has a completely different life with neuropathy, different symptoms. A treatment regimen might work for someone that has the exact same cause and symptoms, whereas it might not work for someone else. There's so many different causes. I've listed some of the more kind of common ones, which includes chemotherapy, as many of you might already know. But interestingly, vitamin and nutrition deficiency is also a leading cause of neuropathy, including vitamin B12, and I'll get more into that as we get into the presentation. But we always need to know what symptoms are happening for a patient, what their cause is, and trying to understand a little bit more about what's happening and why. It's interesting because vitamin B12 deficiency is really common in the elderly. It's not specific to cancer patients, but about 10 to 25% of people over the age of 80 may actually have B12 deficiency. Several causes could be known. A vegetarian diet might promote B12 deficiency because animal-based foods such as red meat, dairy products, fish, poultry, eggs, things like that, they are the only recognized sources of dietary B12. So if, for example, you go in and your physician runs tests, gets blood work done, and is labeling you as someone that has vitamin B12 deficiency, diet might be something that you can use to kind of help control that. And improving that might also help manage the symptoms that you might be experiencing due to the B12 deficiency when it comes to neuropathy. But currently, there's no cures for neuropathies. Right now, we're really just talking about symptom management, trying to find out as many different treatments and a combination of treatments that work for each individual patient, and trying to manage those symptoms until more answers are known for neuropathy. So neuropathy is a common side effect of certain medications, including those used to fight cancer and chemotherapy. You'll see on your screen a list of some of the drugs that might cause neuropathy. In some people, these medications may cause nerve damage that results in a loss of sensation or movement in a part of the body, but it's really not life-threatening, which is great. The problem with that is a lot of chemotherapy patients, they just they're either undergoing treatment or they maybe ended it, and maybe they fought and battled their cancer. They no longer have it. Now they have survivor's guilt, so they don't want to complain about some of the symptoms that their neuropathy might be causing. So we try to manage that. It's really hard to kind of put a price on that, because I think chemotherapy itself is a very difficult process. And then having some of the symptoms from neuropathy come from those drugs that help save your life, it's hard to complain. So that's kind of what I was talking about for survival guilt. But sometimes if you discontinue the drugs, your neuropathy might go away in a couple of days or even a couple of months. But sometimes it doesn't, and the nerve damage may be permanent. So again, getting more tests run from your doctor will give you a little bit of a better sense of what's happening, and how those drugs may or may not have caused the neuropathy that you're feeling. So ultimately, there's various treatments, there's various therapies that you can undergo, medications for pain, safety measures to kind of curb the loss of sensation that you might be having if you're experiencing numbness, and just basic lifestyle changes, including exercise, but also diet, which kind of leads me into the main points of what I was asked to speak about here. So the simplest thing that I think you can do, and this has nothing to do always with chemo-induced neuropathy, but I think generally always look at what you eat. People will listen to that. A lot of it's just common sense, but it makes much more of a difference when your healthcare provider tells you and reinforces what you know. So what I can tell you is omega-3 fatty acids, really good for you. Mackerel, salmon, herring, bluefin tuna, lake trout, anchovies, things like that. Those types of fish, really good for you. Nursing research has showed that more than 5 servings of fish per week reduce the risk of stroke by half. So not only could you be helping your neuropathy by choosing a better diet, but you might also be helping a lot of your other potential health risks down the line. Eating shark, swordfish, tilefish, try not to do that. They contain high levels of mercury. Flax seeds are great. Lots of various nuts, really great. They have a lot of those omega-3 fatty acids. And we're trying to target for about 1,000 milligrams a day. And it may help regenerate nerves, having these acids in you. Lots of that mainly helps with the type 1 diabetes patients, but again, doing this I don't think is going to hurt anyone. But ultimately, when it comes to nutrition, what I say and what a lot of our scientific experts at the Foundation for Peripheral Neuropathy say is, if you can't pronounce it, don't buy it. So many times people are reading labels, you can't pronounce it, it's not natural. So I think that's always the number one thing, is try to buy what you know you can pronounce, and always just check with your healthcare physician, check with friends, check with your local groceries even, just to see maybe what the best fish or other food to eat is, depending on where you live. Fruits and vegetables, 5 servings a day. I feel like this is something we all learned in health class back when we were in grade school, but it rings true for neuropathy patients. Always choose the brightly colored fruits like tomatoes, berries, broccoli, avocado, spinach. They're brain food. It's great. And it functions as a natural Aricept. It's a drug used for dementia, actually. So again, another potential kind of risk that you're hoping to avoid by just eating healthy. Not only is it going to help your neuropathy symptoms, might actually even reduce them or completely take them away, but it will help kind of control the rest of your health as well. Another thing is a gluten-free diet. So we've had studies that show that gluten-free diets and those with celiac disease may benefit their neuropathy as well if you cut out gluten. It's also really great for weight loss, for metabolic syndrome, which is associated with diabetes. Always just think about what kind of substitutes you can put into your normal diet. Brown rice, quinoa, teff, buckwheat. It really is important to kind of play around with your diet sometimes, or go to a dietitian and ask if this is something that might be beneficial to you, knowing that it typically takes anywhere from 6 to 8 weeks for any one diet to kind of show results. So if, for example, you cut out gluten-free products for a few days or a couple weeks and you're not seeing any results, there's a reason why it does take a little bit of time. Alcohol, not telling you guys you can't have a few drinks every now and then, but alcohol is a cause of neuropathy. And even if your main cause might be chemotherapy and the drugs that you took when you were on chemo or currently are still on it, that doesn't mean that alcohol might not also be an underlying cause. There could be many different causes of your neuropathy, which makes this condition extremely complicated and very difficult to diagnose and treat. But generally, cutting and reducing alcohol is a good thing for nutrition. Same with artificial sweeteners and sugar. Trying to reduce processed foods. Again, if you can't pronounce it, please don't buy it. Really, sweetened beverage intake, it's been tied with cardiometabolic risk factors, which again leads possibly into dementia. We've been doing lots of various studies on sugar, and ultimately sugar is just not great. So I think that's one thing that I think is an agreed upon resource. Look, eat what you can digest. Some people can't tolerate or digest healthy foods like kale or cauliflower, beans, chickpeas, but typically you shouldn't have problems. But again, check with your primary physician. We do encourage sometimes to reduce dairy intake. Lactose and dairy intolerance are very common and can contribute to inflammation, which is a cause of neuropathy. And just choosing conventional versus organic foods. Obviously, organic foods sometimes are very either hard to find or higher in price. So I appreciate that. But at the end of the day, choosing maybe an organic milk, something that you or your children are drinking frequently might be better. And it kind of helps to kind of take away some of the unknowns and the other things that get put into some of the other foods that are not organic. But generally, specific diets are always great. Vegetarian diets are great. However, as I previously mentioned, if you do a vegetarian diet, check your B12 levels because you're really not getting as much of the intake from the meat and other foods linked from animals. Exercise, just in general, kind of go hand in hand. We've noted that just general lifestyle changes along with nutrition really help to improve a lot of symptoms associated with neuropathy, specifically pain. Low carbohydrate, where's this discussion originating? So the low carbohydrate approach is one that many readers are probably familiar with because diabetes or those that are bordering diabetes, right, where they're trying to control their A1C and their sugar levels, that's the leading cause of neuropathy in Western societies, and diets help improve blood sugar, which is also known as glycemic control. And when you kind of reduce carbohydrate intake, it typically helps your diabetes, it helps those blood sugars, and then typically the symptoms that might be looking like their neuropathy symptoms might also lessen. It reduces the need for medication as well by having a healthy diet, especially for patients with diabetes. But I think just generally anyone that can make some better choices with diet is great. At the end of the day, neuropathy progression is a very unique progression, and it's a unique life for every individual patient. It can slow or stop. Over time, peripheral nerves can even heal, and in each individual's case is different in terms of how and when that happens. So adhering to a low glycemic diet can really help reverse or even stop neuropathy. And again, reducing other drugs and other medications that might be causing it also is a fantastic kind of opportunity for you guys to take a little bit control of your life with respect to that. I have here a ketogenic diet. There's a new body of literature emerging about the broader application of the ketogenic diet treatment for treatment of pain, including pain related to neuropathy. So if you do have painful neuropathy symptoms, it's a very interesting diet that you could look into. It's high fat, low carb, and there's some restrictions with protein as well. So I would, maybe ask to see if there's any benefits that could do. And anti-inflammatory diets, they may even enhance your brain health. Research has clarified the influence of inflammation on various neurological conditions, including neuropathy. And we're just trying to learn a little bit more about chronic inflammation and how food can either aggravate or ease the problem. But again, anti-inflammatory diets, I think, are good no matter what. So that's almost pretty much what I wanted to share with you guys. Just reminding you, I'm with the Foundation for Peripheral Neuropathy. We have a lot of really great resources. We also have an email list if you guys are interested in learning more. We also have plenty of educational materials and live webinars with respect to chemo-induced neuropathies, pain management, other types of nutrition, and other experts that kind of come in on a monthly basis and just share some really helpful information. So I encourage you to visit our organization's website, reach out to us, and check out a support group if that's something that you're also interested in, connecting with other peripheral neuropathy patients in your local area or just throughout the entire world, knowing that Zoom is possible, and sometimes it's easier to not have to leave your home and connect with a lot of other people that might have some really great tips. So with that, I kind of open it up to whatever questions that might have been raised throughout here, and happy to hopefully help answer some questions.
Perfect. Thank you so much. And I appreciate the time that you took in preparing this, and excited for you to share what knowledge we have about this topic with the audience.
Yeah.
One of the questions that I had was the cause of neuropathy. We kind of went over that in the beginning, but could it be possible that it's a combination of things that are leading to the neuropathy? And if so, how do you determine which is the main culprit?
Yeah, that's an interesting question, Audrey. Ultimately, there are potentially many different causes. There's actually hundreds of causes of peripheral neuropathy, which makes it such a very difficult condition to diagnose. What we encourage at the organization is to see a neurologist. They are a specialist that go into various neurological conditions, including neuropathy. Obviously, many patients continue to see their cancer-related specialists, but they're not always the best person that can help talk about the next journey, which is neuropathy. And those neurologists will be able to test you for understanding the cause. Ultimately, there's just a lot of various tests that can be run to really understand what's happening, and also taking a full report of your medical history is also good. They'll ask you questions about what you eat, right? They might ask you to go see a dietitian as well. So it's kind of hard to understand what the underlying cause might be, other than just going to see a neurologist. And if you do get diagnosed with multiple causes, they'll at least be able to identify a treatment plan that can kind of help identify those causes and mitigate what's happening.
Yeah, definitely. Okay, so there's a couple questions that are confused about the diets that were recommended. There was a keto diet recommended, but there was also vegetarian. Those are essentially exact opposites. How could both of them be helping neuropathy?
Well, it goes into what the cause of your neuropathy might be. And for example, if you are a diabetic, for example, like myself, I'm a type 1 diabetic. So I actually can't just do vegetarian because it's really good to have high fat, which a lot of vegetables don't have. So I drink a lot of high fat milk. I do a lot of high fat other dairy products, so I don't stray away from that. That works for me. So it is confusing because the diets are completely different, and your healthcare provider might be able to ascertain what might be beneficial to you. But we've proven studies that both potential diets and even more diets that I didn't even list could be beneficial. But again, give it 6 to 8 weeks before you can really assess if it's helping. Yeah, I mean, the thing is, right, if you do the vegetarian diet, then you might have the B12 deficiency, right? So it is confusing, and it's really hard for patients to navigate. So I always just encourage as many questions when you go see your healthcare professional, just to say, you know, I read a vegetarian diet could be helpful for me. Is this something that you think would help maybe calm some of the symptoms? And they'd be able to do some more tests, maybe do some blood work to really understand what other vitamin deficiencies you might have, if you're susceptible to that, if that might help curb some of the inflammation that you're experiencing, or maybe not. But at the end of the day, I mean, I think vegetables are great. So even if you're not eating exclusively vegetables, I think it should be a large portion of your diet. And that's at least what our scientific experts tell our patients to do. You know, eat what you can pronounce.
Mm-hmm. Thank you for that. Laurie's wondering, you know, again, about this vegetarian versus chemo, but her comment is that she's a plant-based whole food, on the plant-based whole food diet, which is a high carb diet. Should she be considering a change? Before you answer, if you have an opinion, I just want to interject. We had a session last night from Dr. Irvi Shaw, who's a multiple myeloma specialist that's studying the progression of myeloma if the diet affects that. And she brought up this very topic, and what she said, and you're welcome to add to this, but what she said was, you know, where you really want to stop those carbohydrates is in the refined grains. So in the white rice, in the white bread, in the carbohydrates that really aren't serving you or your body, those are the places where you want to make the changes, because it's been proven that even though the vegetarian diet does have high carbohydrates, those are carbohydrates that serve you in your body. What is your opinion on that topic?
Well, I mean, I think that's interesting. Ultimately, at the end of the day, high carb is not bad. If you are prone to diabetes, it is bad, right? So I think we want to be careful of that. I think a balanced diet is generally always good. And as long as I mean, vegetables have carbohydrates, everything has carbohydrates. I think it's more just the balance. So that's what I would speak to specifically with respect to peripheral neuropathy patients, is having a good balance, getting the various servings of the various food groups that you need. And if that equates to, you know, several hundred carb intake on a given meal, and then you're eating 3 meals, and then you're having snacks, and now you're eating like 1,000 carbohydrates on a given day. I mean, I couldn't do that. I would probably be in a glycemic shock, but lots of people do that, and they live extremely healthy lifestyles. They don't have any issues with diabetes or with their neuropathy, for example. Again, everything is so individualized that I think the best preface that I can say is I wanted to introduce some of the options to you, because there is no one answer. So a patient really needs to kind of look into what they think is best for them, talk with their healthcare provider, but then ultimately make a decision that you can also stick to. Because if you say, oh, great, I'm going to only eat vegetables, and now you're sitting across the table from your wife who has this amazing steak in front of you, and you're getting all the fumes and it's causing you great stress, because all you want to do, and you can't stop thinking about how delicious that steak is going to taste, I mean, it's not manageable. We're trying to choose a diet and choose a lifestyle that you can manage, not just for 6 to 8 weeks to see if it works, but really for a lifetime.
Yeah.
So when I say don't drink alcohol, I don't mean don't ever drink alcohol, but, don't drink it like, you're going to a college party, right? Have a few sips every now and then, unless you see your symptoms progressively increase immediately following that glass of red wine, at which point then I think that should be a key indicator that, you make the choice. Do you really need that glass of wine, or do you want your symptoms to ease? So I think that's kind of what I would, that's
it's complicated. Yeah. Thank you. Are you aware of omega-3, consequence of omega-3 causing your blood to thin and making you bleed too much?
Yes. So we recommend a target of 1,000 milligrams a day of omega-3 fatty acids. Higher doses may result in higher blood bleeding. That's right.
Okay. Do you know the difference between small fiber and large fiber neuropathy?
Yeah, so we actually have a lot of information on our website, and maybe I'm going to try to pull it up and I can share a screenshot of something.
And we can share it too. We send an email with the recording and resources and the slides and all that. So we can make sure to include as well that your website in our follow-up email so that they can become connected with your organization.
Yeah, no, that'd be great. I'm trying, as I said, I'm like anxiously typing over here with a very slow internet, so apologies, but I think so ultimately small fiber neuropathy is usually there's a lot of research done with respect to small fiber neuropathy, because it's actually a very difficult condition to diagnose. It's part of the kind of idiopathic in nature case. Idiopathic means I don't know the cause, which is a very frustrating answer when someone does all the tests and then they say, we don't know what's the cause, you have idiopathic neuropathy. So small fiber neuropathy affects the small fibers versus the larger fibers, but there are different causes within that. I'm just trying to get a little bit more information that I can maybe cite a study. But again, it is going very slowly over here. So
that's okay. While that's loading, let me ask you a couple other questions that you could possibly answer. You mentioned, if they're on that if they're on that vegetarian diet, then the vitamin B would be diminished. But what about taking supplements such as vitamin B or magnesium? Are those recommended by the research that's been done? And if so, should they be taken daily?
Well, I don't want to speak to how frequently or the dosage, because I think that needs to be an individualized question that everyone has with their own professional medical care providers. But the answer is yes. There are lots of times when a B12 deficiency is identified, at which point then they either change their diet and or have a supplement that they take to kind of help curb what's happening. So the answer is yes. There's obviously supplements and plenty of them. It's interesting because it's not just B12, but like other types of, I'm trying to think, like magnesium, like a lot of other things that are really good for you that you can find in nuts, for example, that if you don't have it in your diet, or for example, maybe you're allergic to nuts and you can't have it, so you can't eat cashews, which are high in copper and magnesium. So then you try to figure out, well, where else can I get the magnesium from? What other food or supplement? What doctors typically recommend is consuming it within a food is better with respect to digestion and intake than just taking a pill. At the end of the day, though, pills are better than not taking anything at all. But again, when it comes to quantities and frequency of what that intake should look like, I really would defer to a physician that would be able to speak to an individual care plan.
Yeah, I think oftentimes too, wherever you're being seen by the neurologist, if there's a dietitian that works in that same facility, that would be a good place so that they can be working together and know your condition and be able to help you.
Yeah, 100%.
Yeah. There's a couple questions about something that I am probably going to butcher the pronunciation. Alpha lipoic acid.
So alpha lipoic acid is a potential treatment. We actually, I was an author on a recent publication through the American Academy of Neurology on this actually. And we tried to look at updated guidelines for what can be done with respect to various treatments, including ALA. So next time, call it ALA. It'll
Okay, thank you.
So it is a potential treatment that we have up on our website as well. At the end of the day, we always encourage people to kind of talk with their physicians to see if this is a treatment plan that can work for them. But is there a specific question regarding ALA that I can help answer?
Yeah, so one of them is, can it be combined with other things to help neuropathy? I think it's just, does it help?
Yeah, typically we do encourage a multi kind of prong approach when it comes to treatment options. Nutrition alone hasn't been proven to be effective, like including lifestyle changes. Other medications might need to get kind of intertwined into your daily kind of routine to understand. So the answer is alpha lipoic acid. It is a tongue twister. ALA is a great option to ask your physician if that's something that would be helpful to you. But ultimately, ALA is there to help possibly mitigate the stress that you have in your nerves, and stress damages the nerves. But it's also concurrent when it comes to obesity and other related conditions like diabetes. So if you take lipoic acid and you're trying to reduce the stress and the damage that you have within the tissue and the nerves, there's evidence that it might support insulin sensitivity and other healthy glucose levels. So I would say ALA is a good option in combination with a better nutrition, a better lifestyle challenge, and then you might actually see some of the nerves and the tissues either rebuild or at least not further degenerate.
Okay, perfect. There's now a lot of questions about ALA. Can it be, and so if you can't answer these, feel free to just say I can't answer them, but is it recommended to combine it with acetyl carnitine? I wish I knew how to pronounce these.
L-carnitine. So that helps maintain the myelin sheath, which surrounds and protects the nerves, and it enables them to transmit messages at the optimal speed. So researchers found that acetyl-L-carnitine can help to support nerve health, both in people and even in animals, but the results have been inconsistent so far. So researchers consider it to be a safe supplement for supporting nerve health, but they have not made any claims that it supports any nerve growth, and it does not officially reduce oxidative stress. So there has not been enough studies to show the benefit. It shows that it's safe. It shows that it can't hurt. I don't think if it's in combination with or without ALA, alpha lipoic acid, it will have any better of an improvement or not. I think there's just still too many studies out there that don't have those answers. So the answer is, I don't know.
Yeah, that's okay. Thank you. There's a couple of questions about L-glutamine powder. Have you heard of that as a treatment, and do you recommend it?
Also have heard about it. At the end of the day, we as an organization don't ever recommend anything. We're just here to kind of share resources and then leave it up to the appropriate medical professionals to say whether or not this is something to incorporate. So
Yeah.
It's extremely difficult to absorb from pills, actually. And it has been showing promise to have superior absorption and enabling absorption of, let's say, alpha lipoic acid and other vitamins, which are known to support nerve health. So ultimately, it's about oxidative stress and what your levels are looking like to see if the various supplements and acids can be in combination or by themselves helpful or not. But researchers have shown that, let's say, alpha lipoic acid, L-carnitine, selenium, vitamin C, and then NAC as well have been proven to help kind of stabilize and support nerve health. So according to my research, it can't help, but there haven't been enough studies to show really the long-lasting effects on the myelin sheath and the tissues to support it.
Yeah, I think, and it's okay, you know, that we're not sure, we don't have these answers, because it gives a foundation next time they go into their neurologist, next time they go into their oncologist, they're able to come with these questions and better understanding of the product so that they can consider it or get tested to see if they're the right candidate for this kind of treatment. So
what I would add to that is really the most effective way to supplement for nerve health is to understand what's compromising your nerve health. So get tested for B vitamins, get tested for magnesium deficiency, find out if you have biomarkers for oxidative stress. Because really the only way a supplement is ever going to work is if you really need it.
Mm-hmm.
That's why I can't answer if that's going to work for any one individual, because they really need to get various tests and diagnostics done to really see what their various levels are. And based off of that, then the physician will say, you're really low on this, let's get your magnesium up, let's get your B12 up, things like that. So that's I think the best suggestion I have to say is really understand what's compromising your nerve health, get the various tests, find out if you have biomarkers and genetic predispositions for other stresses related to your nerves, because those answers will help determine all of these questions that everyone's asking.
Yeah, that's awesome. Thank you for helping guide them in that way. Does electrical stimulation help neuropathy?
We have shown that that is a treatment that helps. It helps with sensation in the extremities. So for example, if you're either have pain, what it actually does is it switches your brain to stop the pain signal and divert it elsewhere. So there's lots of different devices and treatments with that's been proven to be very successful in some patients. It's interesting, there's even a placebo effect with that, where you put on some type of unit or something and it's not actually sending a real signal, but right? There's plenty of, clinical trials where you have the placebo effect. But regardless of that, I think it has been proven to be effective, either to kind of reroute the brains so that you're not concentrating on the pain, or similarly, if you have the numbness and you don't feel the sensation maybe in your fingers or down into your lower extremities, like your feet, you put something on kind of right around your knee or your calf, and it kind of helps there's some stimulations that kind of go down towards to kind of help waken up the nerves.
Mm-hmm.
And people have shown that they have increased sensations, which is great. And typically then when they stop the treatment, it either stays and great, it's fixed, or they're back to square one and they have to go back to do that. Now, again, like any other treatment plan, they're not cheap. Some aren't always covered by insurance. So I would always just encourage everyone to check with their physician to see if this is something that would be helpful. But at the end of the day, the doctor might not have a guarantee of, yes, this will be helpful, but they might just say, yeah, this could help you, at which point then, you
have to make the decision. Yeah.
Make the decision and give it a try and, give it 6 to 8 weeks, see if it's improving, right? That's kind of my my clinical suggestion, 6 to 8 for any new kind of regimen to see what the impacts and the effects are before you make a decision to continue or quit.
Yeah. Thank you for that. Is there a difference between neurologist and neuromuscular doctor?
No, I mean, they're all kind of within the same kind of broad umbrella. What we tell patients that are suffering from neuropathy is to see someone in kind of the neurological field. But when you're kind of calling a bigger institution, ask for someone that specializes in peripheral neuropathy, or even more specific, chemo-induced peripheral neuropathy or diabetes-induced, right? I mean, there's some causes. So then you have peripheral neuropathy under the umbrella. And then within that, there are lots of other doctors, the neurologists within there that specializes in certain causes. So we always encourage our patients to really understand what's happening, but sometimes you don't actually know, and that's your first visit. Well, I don't know what my cause is, so I'm just trying to see. So then, just get get someone. It's better than no one. They'll be able to test you like any other specialist would, and then if they confirm what your cause is, or confirm maybe a little bit more of a specific issue that you might be facing, maybe it's genetics, maybe it's other things, then you can maybe ask, are you the proper person that can help continue on this journey with me? Or do you have another expert that you think would be better equipped to answer some of the questions that are personalized to me?
Awesome. Thank you. In line with that, when somebody suspects that they might have a vitamin deficiency, what's the test that they should be asking for? Or what's something that they can go in and ask their doctor, can you run these tests to check for me? What would they be requesting?
I think it's as simple as, can you check to see if I have a vitamin deficiency, including B12 or magnesium? That should cut it.
Okay.
Professional. So there might be specific tests that you could ask, but I don't know. I think if you just phrase it in a very lay terminology like I did, I'd like to think that the doctor would be able to take it to the next step.
Yeah, I like that. Is canned salmon a good source of omega-3s? And do you suggest omega-3 supplements or no? Well, I know you can't suggest them, but has studies shown omega-3 supplements are beneficial?
Yeah, I mean, ultimately, yes, omega-3 supplements are beneficial, especially if you are lacking that. I know that salmon is great. I don't know if it has to do with fresh salmon versus canned salmon. I can't speak to that.
Okay, that's okay. Barbara is wondering, one of the things was the anti-inflammatory diet. What kind of foods are decrease inflammation?
That's a great, so I'm trying to think of anti-inflammatory diet. I don't have specifics on the type of foods you should try to avoid. I'm trying to see if there's anything in my notes, so apologies for
No, that's okay.
but if one of the medical experts on this call knows that answer, I encourage them to interrupt, because I'm not sure if I have anything specific to that diet other than Googling it myself, but I don't like to be Dr. Google. So yeah, I think this is one that I'm not as sure about. So I'd prefer not to speak specifically about what that diet would look like. But I do think that'd be something that you could ask a nutritionist or your primary physician to understand, just to see if maybe you're already doing an anti-inflammatory diet, or maybe there are certain things that you can try to cut out to limit the inflammation that might be causing some of the damage to your nerves.
Yeah. Okay, another question. You mentioned that exercise is something that's recommended within your foundation as well. Has the exercise been proven to improve? Has it been proven to improve neuropathy? And if so, how?
Yes. So kind of like with anybody, neuropathy patient or not, exercise movement is just good for your body, right? So we have shown, and we speak with lots of physical therapists who give lots of various exercises to kind of help if someone has balance issues, right? So then they target what you're suffering from. Maybe you have numbness or pain or other things, but here are some other exercises to help strengthen other areas of your body that can kind of help mitigate the balance issues that you have, or similarly, identify exercises that don't cause you pain. Because at the end of the day, we always say, yeah, start exercise, but if you haven't exercised, just start maybe with a 5 to 10 minute walk. And if that's going well, next week, up it to 20 and maybe increase to a little bit of more moderate exercise, try to include in some strength training, things of that nature. But at the end of the day, again, exercise regimens are interesting because we never want anyone to undergo a new exercise regimen without kind of consulting their physician first, especially if the symptoms from their neuropathy is causing them pain or other limitations. We want to make sure that exercise is still safe. Similarly, I'm a person, I love to work out. And when I push myself, I feel that pain, but it's like a good pain. And it doesn't actually cause me to be laid up in a bed for the next week because I twisted my ankle or I pulled something, or, you know, I have some muscle that's throbbing or a number of other things, right? But you have that kind of that pain from your heart and your lungs when you do the cardio, or the pain, like, you know, lifting something really heavy and, you know, but you never want to lift too heavy because you actually could hurt yourself. So I think at the end of the day, the pain throughout the workout is okay, but only you know if it's an okay pain or if it's something that you should be concerned of. So that's what I would decide. And as far as kind of research goes, we actually had a paper recently published from our biorepository. So we have a biorepository that stores various human blood samples, plasma, serum samples, a lot of other patient materials. And it had to do with exercise and whether or not exercise was proven to be beneficial for neuropathy patients. And what was really funny is the outcome was, of course, yes, it is, but it went into a little bit more details and showed a little bit more trying to understand, you know, if pain was the cause and if exercise helped to curb the pain, and what's regular exercise, and is that 5 times a day for 30 minutes? What's your heart rate look like? So ultimately, we learned that patients can definitely benefit from exercise, even if performed on a low intensity. And if you exercise frequently, every day, kind of for the rest of your life, even if it's a low intense 5, 10, 15 minute walk, they are less likely to have a lot of various symptoms, mainly associated with pain. So that was really interesting. But again, it's kind of one of those things, like, I feel like we kind of all knew that exercise was beneficial, right? Just like eating a healthy diet is beneficial. But now we have a little bit more stats to show for it.
Yeah, that's exciting. That's great. How would you determine, or not you specifically, but does the foundation have a scale of how bad your neuropathy is? We have one patient who's wondering, if I went from, you know, stabbing pain to just feeling like I have socks on all the time, could I consider that an improvement? What would be your response to that?
Well, the answer is yes. I would definitely consider that improvement. We do, I mean, it's a pain scale of 0 to 10. So when you go into a clinic and you speak with a neurologist, they kind of, you know, they do the happy face and the sad face, but then they go into a little bit more details into like what 0 means versus what 10 means. They can even do a lot of tests to kind of understand the pain levels and really what's happening. There might even be something that can be seen through, you know, an EMG or something to that extent. But then the sock feeling, even though I would say, hey, that sounds a lot better than the stabbing pain that you were originally feeling, the sock feeling is actually extremely common, a common symptom when it comes to neuropathy patients. That's still annoying, don't get me wrong. And I don't think that you should be the, well, it could be worse, so I'll just—
At least it's not stabbing me. Yeah.
It's not stabbing me, so I guess I'm okay with it. I shouldn't complain. But the answer is actually you should complain. I think there are other medications or treatments that, again, you can consider taking, even if there's lots of creams and ointments, things like that can kind of be applied directly to, like, for example, the foot or the hand, that would target that feeling, which is very common. So I would personally say that is an improvement.
But don't stop there.
What any neuropathy patient is actually going to see is your neuropathy is this today and something else potentially tomorrow. And it could be better and it could be worse, or it could just be different. And maybe that's what the answer is. It sounds like it's more just different. Thankfully, you're not having the stabbing pains anymore, but the common sock feeling also is kind of a cumbersome thing. And that might translate into something different tomorrow, which may be better or worse. And if it's the latter, I think kind of, again, talking to your doctor about that to try to see what can be done before it shifts into something else. Maybe this is the time to do some type of different treatment plan.
Yeah, I think it's exciting too, because they mentioned they got from that stabbing pain to the sock feeling through their diet, through a diet change. And I think that's just a testament that, at least in this one person's case, diet may not cure your neuropathy, but if you would like to have that sock feeling instead of the stabbing pain, maybe you look into, applying some of these diet changes that were mentioned today.
And again, a combination of other treatments could also be the answer, right? The only thing that they've been doing is a diet change. Great, it looks like it's been showing some improvement, but you still have something else going on. So what else can you use to supplement, right? And not a vitamin supplement, but more, what else could you do potentially to help kind of curb now that symptom?
Right. It's going to be a combination of things that bring out a relief for you.
Quite frequently, our patients say there is not just one thing that they're on or that they're doing. It's a multifaceted approach. Nutrition is a big role of it. And as I said, even if the nutritional aspects that I kind of outlined and shared some options within this presentation, even if that isn't actually helping your neuropathy, it's probably helping something else. So I wouldn't say go back to eating your processed foods, stick to that, still stick to a really healthy diet, because at the end of the day, you're not doing yourself or your body a disservice by eating your fruits and vegetables and,
Yeah, totally. Let's go over a couple more questions and then we can finish out. So, hi, Steve.
Hi, how's it going?
Good. Did you want to share anything with us?
I was just going to say that, like the doctor was saying there, it is a multifaceted thing. We see a number with our patients that are on medications, gabapentin, Lyrica, stuff like that to help with neuropathy, but we also encourage exercise, nutrition with green leafy vegetables is a big one, nuts, fruits. Staying away from the processed stuff like was previously mentioned, just because all of that can add to inflammation, can add to things like leaky gut and malabsorption. And really when it comes to what vitamins are best, it's find out what you're deficient in and then do things to either supplement or infusions, stuff like that, shots, whatever we can do to build those back up, to get the stores back up to a baseline. And then from there, try to make the lifestyle adjustments to keep it there. So that's just what I wanted to point out.
Yeah, thank you. Thank you for that. And Steve is a nurse at the Huntsman Cancer Institute for Health in Salt Lake City. So he's joining us today as a medical professional to help with the talk. So thank you, Steve. One more question for both of you. Yvette is wondering, along with the neuropathy in her feet, she feels numbness in her upper outer thigh. Does this have to do with my neuropathy? Do you guys see neuropathy outside the normal places like hands and feet?
Yeah, it can travel up. It does travel. It rarely goes into your central, right? You have a central nervous system and a peripheral nervous system. So your peripheral nervous system kind of starts right here at your arm, and similarly to your leg. I won't stand up, but I think you understand where I'm going. And typically when the neuropathy starts, it starts at the extremities and hopefully it stops.
Okay. Do you think it's possible for him to come up too? Is that realistic?
Sorry, I'm getting some feedback. Apologies.
Yeah, it's okay.
So it starts in the extremities, and it either works its way slowly or maybe it starts the whole thing, but it can work all the way up to the extremities. Now, it's rare to go all the way up into the upper thigh. But again, I'm not a medical professional, so I think that'd be something you should go get checked out and just kind of have tested to see if that is neuropathy related, or if it's something else altogether.
Steve, do you have anything to add on that?
We have seen a bit of this with especially chemo-induced neuropathy, where it will travel up. It does usually start in the fingertips, toes, stuff like that, and it'll try to travel up. We try and dose modify stuff like that before it hopefully travels up into the thigh. But in extreme situations that can happen. And unfortunately with the larger nerves, it does take a long time for that to reverse and to calm back down. Nerves are just a slow healer. So it does take some time with that.
Yeah, thank you for sharing that. So definitely that's something that I would talk to your treating physician about. She said it's not constant, which is good, but hopefully if we tackle it now, then we're going to be able to start reversing whatever it is. Doreen is wondering if compression stockings help with neuropathy.
They can, yes. We are very familiar with lots of different socks, not just compression socks. We actually have a blog post dedicated to shoes and socks, ones that are more supportive, less supportive, things that go all the way up to your knee versus shorter ones. There's a lot of different brands out there. We actually had a Facebook kind of survey in the last year or so where people were telling us all the different shoes and all the different socks that they had tried, various brands, various things that worked, various things that helped specifically with pain versus numbness versus other sensations. So that's an interesting thing. If you remind me, I'd be more than happy to share that post with you and you can distribute to your folks. But we're very familiar with it, and the answer is yes. But it might not help everyone, right? And that's kind of unfortunately the story that I seem to be saying over and over again during this talk is, there's really no one thing that works. It's a combination of things, and any one combination is only going to work for you versus your neighbor who has the exact same thing. It's a very devastating and hard condition, but it's one that you can live with as long as you kind of take control, ask some appropriate questions, make some lifestyle changes, and have some patience, but also have some hope. Because as I said, if you're a cancer survivor, you shouldn't have survivor's guilt. You shouldn't feel bad to complain about your neuropathy symptoms just because, well, hey, I just survived. I just beat this cancer. I'm not one to complain, but you are one to complain because neuropathy is a devastating condition. It impacts so many different people. It's estimated about 30 million Americans alone suffer from neuropathy at this time. Chemotherapy is a very large contributor from all the various drugs that get pumped into your body to attack the cancer. They cause sometimes neuropathy and other symptoms related to nerve damage. And sometimes you stop the drugs, you get better, other times you don't. And it's something you have to live with for the rest of your life. But, we are looking for cures. We have a lot of various treatments out there. And I think at the end of the day, if you do your homework and you're talking to the right physician and you just take some time to find out what the proper regimen treatment plan for you is, you're going to find something that you're going to be able to still live a very, very happy and not painful or not annoying life.
Yeah, perfect. That's awesome. And that's a great place to end. Steve, I don't know if you have anything else that you want to add. Okay, awesome. Thank you both for joining us today. Lindsay, that was an amazing presentation. There's a lot of positive feedback in the chat right now. Just thanking you for that excellent presentation. And Steve, thank you for your input and your answers that you gave as well. I think this discussion has really given a baseline where our patients can feel more empowered when they go in to speak with their neurologist and their oncologist and be able to have a more productive conversation and have hope in their diagnosis, like you mentioned, Lindsay. So thank you. We're going to end with just a couple of announcements. And we apologize for not getting to everybody's questions today, but we do appreciate your participation. This has been an excellent session. Thanks to your participation. So thank you. Our meeting next month will go into studies revolving the role of supplements in a blood cancer patient's health with Terry Colbert. She is the founder of MGUS Therapy and will be joining us all the way from Australia. So while most of the studies have data from precursor myeloma patients, there's also some data about current active myeloma and how supplements can play a role in their health. And this meeting is going to be beneficial for all. So please join us next month for the role of supplements, which I know is a huge question, especially curcumin. She's going to talk about vitamin C, and we're going to be able to get some of the preliminary answers that we have from these studies that Dr. Colbert has made it her life mission to accomplish. You may be interested in other Myeloma Crowd community events we have coming up. Tomorrow at 2 p.m. Eastern is the African American chapter, and we're going to be talking about fitness tips for your winter exercise reboot. Fitness expert Vanya is going to join us, go through a little bit of exercise and talk about tips that she has for staying fit through the winter, which lasts way too long in my opinion. On the 1st is the Myeloma Financial Coach chapter. We're going to be doing a budgeting workshop to talk about how to pay for the costs of myeloma and even cancer in general. We're going to invite our sister foundation, the HealthTree Community for AML, to join us for that one. The 2nd at 7 p.m. Eastern, we're going to be hearing from a sexual wellness therapist who will be talking to us about how to maintain and communicate our sexual wellness and sexual health, even after chemotherapy and during chemotherapy. The link to sign up for any of those events and even more events I didn't mention today is found at the bottom of this slide and will be sent out in our follow-up email. That follow-up email will include the recording, the slides, and the resources that we've mentioned today, including the link to the website for Lindsay's foundation. And again, a thank you to all of our sponsors, Bristol Myers Squibb, Takeda Oncology, Karyopharm Therapeutics, Adaptive Biotechnologies, Janssen Oncology, AbbVie, Sanofi, Amgen Oncology, and Genentech. Thank you again for this wonderful discussion. Thank you, Lindsay, for your time, Steve, for your time. We appreciate you for helping us build a strong Myeloma Crowd community and hope that you have a great rest of your day. Thanks so much.